Overall, I have loved this program because I found everybody to be very, very kind. I have really enjoyed that all of the mentors here, including research and also clinical, truly seem committed to our growth and to our education and to making sure that we have a really wonderful summer. And so whether that's providing recommendations for restaurants to try in Philly or connecting us with their colleagues who have similar academic and research interests, I do feel that everybody here has been really committed to making sure I take the most out of this experience. And that is something that is very special.
My favorite thing in the program so far, I think, has to be the discussions we've had. So on Wednesdays, we have our didactic sessions with various clinicians, and they have a wide breadth of different experiences. And not only clinicians, but also the chaplains and social workers have had the opportunity to speak with us, and they've just brought so much insight and so much knowledge that has been amazing. And I really have enjoyed the discussions we've had. Specifically, the ethics conversation we had was very informative and made me think a lot differently about certain clinical experiences and situations.
Getting a diagnosis, a life-limiting illness or serious illness is not something that you can imagine until it happens. And for a lot of these folks, I'm here in these conversations and I'm present, I'm listening. The palliative care fellows, the attendings, everybody's learning, and they're using all these different frameworks and conversation guides to help the patient, sort of to help guide them in what they want out of their care. And I think that's extraordinary.
Another clinical experience that really meant a lot to me was the home visits that we've done. So I was able to shadow a hospice nurse as well as a palliative care nurse practitioner who was doing home visits. Those visits were very impactful for me because it brought me closer to the circumstances that patients deal with on a daily basis and really put into terms what patients deal with outside of the hospital.
My favorite clinical experiences so far have been the family meetings and also generally the interdisciplinary nature of all the people that I've been able to shadow. It has been really special to shadow chaplains, social workers, physicians, APPs, even pharmacists, and see the breadth of knowledge that the palliative care team provides.